slightly tiptoe and walk. They cannot tolerate loud sounds. So even if a balloon starts, bursting, they cannot. They get like very, very tensed or scared. Okay, and then they spin objects. They themselves spin also. So these are few diagnoses, because there's no specific test to find out whether the child is autistic. It's just with their behavioral changes which will help them to calm them. So these are few things that we need to observe with the child to understand whether they are autistic. Okay, so as I told you, they are very much sensitive to senses. That's like the first foremost thing for an autistic child. Their senses are very sensitive. So now I'm going to just play a video for y'all, just to show from their perspective, from their world, if the sensory overload is there in the brains, what will happen. Okay, so Jasleen, can you play the video for us?
Yeah, sure. Susan, just there's one relative question which has come up. Can you answer? So, will they have
Yeah.
all of these symptoms that you have showed, or will it be any one?
Yeah, it's not all of it. For every, again, I have to tell you that every autistic child is different. So they might have only like 2 to 3. It's not like they'll have everything. Okay, it's they might have 2 to 3 symptoms. One will have more and one will have on the lesser side.
Yeah. So, I'm playing the video now.
Yes, please.
Were you able to hear the video?
I was able to, but I'm not
Yeah.
about the other.
Yeah, yeah. Then it
So
would have.
basically, let me just make you all understand what happened in the video is the child is not able to take the sounds which is around him, because they have very sensitive senses. Okay, so let it be hearing, light, noise, everything. It's like on the higher side of their senses. So even if it's a small laughter sound, or even if it's a small like a pen patting sound, or maybe any of the sounds are like slightly higher than the normal that we can hear. Okay, so we need to be taking care and them a lot. Okay, so autistic child will seem okay in the behavioral changes, even so much of when chaos is running in their mind, they still feel like from outside they're all okay. But sometimes due to overload happening, so much of the light, everything which is giving so much of anxiety and stress towards the brain, for that to calm down, they have some behavioral changes to calm them. Okay, like see example, when we are scared, okay, what we do, we bite our nails and we try to fidget with our hair, we try to hug ourselves, we bite our lips. So many things are there to calm ourselves. Same thing for an autistic child also. They develop such behaviors to calm themselves or to cope up with such kind of moments which is giving them the stress. And what it is, they basically, firstly I have to tell you why do they get stressed or upset also. So over here in the slide it says sensitive senses, as we saw in the video, like a coffee, I mean like a coffee pouring into a mug, or can it be any a laughter, or maybe the sounds of the vehicles. Everything is very much like very crystal clear for them, that irritates them a lot. If a routine changes, like if kind of a routine, like imagine that you're taking the child to a school or something in the same routine, and suddenly a direction changes, they become upset. But you will not be able to understand why they are cranky. For them, they would have firstly absorbed everything. They're very observant. Okay, so let me tell you, they're very observant, they're very sensitive. So any small routine changes, it can be from the things that you placed near them, or the food that you placed, or maybe a plate or the clothes. So they have one set, they've already like fixed onto something. So if a little routine changes, suddenly they become cranky, they get stressed out, and they become upset. Next is if you're forced to do things, like if you're forcing the child to play, if you're forcing the child to have eye contact, forcing the child to talk, it will definitely stress them up. And then if you're asking questions repeatedly, so give them time. Firstly, because they're more sensitive, and they think that they are not accepted by the world. So, firstly, we need to give them some time. So, if you've asked them a question, be patient till they answer, rather than popping up with more questions and stressing them out. So, in the next slide, we can understand when stressed out, what do they do? So, as I told you, to develop on all of these, they get stressed out sometimes, right? So, with that, they yell, they shout, okay? They go to and fro. So, to calm them, they go like back and forth. They maybe flap their hands, and they head bang to the wall or wardrobe. They tend to spin, they tend to do repeated tasks. Like imagine that you've given them a jigsaw puzzle, like they will repeatedly do it again and again, because that is somewhere they are coping up to calm themselves, because the factors around them is definitely not going to change much until and unless we support them, right? So to calm down that stress and anxiety which is like bombarding on their head, these kind of behavioral changes are seen to calm them. Okay, so these are one things. So with that, taking you to the next slide, I would be showing you what are the levels of autism. Okay, so there are different types of autism. Firstly, I do not want to go much into it. And then with that, there's a level of autism also. Okay, so again, level one is maybe he's just having problems having social interactions. Level two, maybe with the social interactions, they have like special interests that they want to be away. Third levels is again they need an extra support. It's sitople. They're not having social things. So for the person who asked me, do they have all the symptoms? So in every level, different person has different kind of symptoms. And again, telling you every is different from others. Taking you to the next slide, you will be understanding much on the characteristics of autism. See over here, if you have to see the autism spectrum disorder, it can be communication difficulties, social interactions. For them, it can be their interest, their sensitivities, like your senses, as I told you, and it can be routine and repetition. So out of this full spectrum, there are different levels, as I told you, and different children. I mean, different autistic child is different. So few of them interest would be high, senses would be low, routine and repetitions are high, and social interaction is less. For few people, communication is easy, but interest is on the lesser side, or there'll be like no interest at all. For few, sensitivities are on the lower side, but communication is high. So we need to observe carefully, depending upon the symptoms and what are the characteristics, that we can help them out. So for this, they have a lot of abilities also, to tell you that some difficult tasks that we cannot do, it's like very easy for them. Like imagine if I have to do like a 50 piece of jigsaw puzzle, which will take a lot of time, for them they can do it in just some minutes. It's the same thing for us, which is very easy. For them, it can be very difficult. Okay, so That again can be like maybe just like brushing our teeth or maybe wearing our clothes is very easy for us, but for them it's very difficult. It like confuses them. So again, as I told, we have to understand them and be very patient to help them out. Okay, because if you actually help them out, they're very observant, so they again try to interact. Okay, because when you keep them calm, they trust and socially try to interact. So it's always better to learn the signs in the early interventions for their difference. Okay, so for now, in the next slide, you will be understanding the therapy. So I'm not going to go much into therapies because I'm not a certified therapist who can tell you what are the different kind of therapies. But yes, after interacting with a few autistic children parents, they have told me that these were few therapies that they have put the autistic child into. So depending upon the characteristics that I've spoken to you on the previous slide, depending upon that, you can improve on the child's behavior or maybe social communication skills. Depending on that, there are different forms of therapies. Okay, so there is cognitive behavioral, there is occupational therapy, then there is some music and development, some exercises. Okay, so it will help them to cope up with their stress and improvise on this behavioral changes. So these are few of the list of therapies. With that, surely the family or the environment has to support them a lot with patience so that they are able to finish these therapies, because they need that extra time to understand what is happening. Okay, so taking you to the next slide, I would be telling you the nutrition part of it, because most of the if you have to see, um, in autism children with autism may limit their food intake, or they're very like their food preferences are very much less due to their senses, as I told you, the smell, the color, the texture. So due to this, what happens, they are lacking on some form of nutrients. That is like for sure. Okay, because they may eat less and they might and not be focusing on their food. They do not want to sit in the same place and eat a lot, so they tend to eat less. And it can even lead to some constipation or any kind of stomach related issues, which is almost seen in many of the autistic children, which will not want them to eat more, because maybe they'll think, okay, I'm going to get a stomach pain, or I'm not able to pass my motions. For us itself, it's like a very irritating if we do not have our everyday motions going perfectly, or we have that bloating feeling, we don't feel well. So all these reasons can affect the children's nutrients or the nutrition. So over here, I'm going to tell you what are the problems faced while eating. So we have firstly the senses, as I told. If your light is too bright, it actually upsets and stresses them while eating. So make sure that your light is slightly on the dim side. Smell. So again, if your food is too pungent with a lot of spices or anything that way, or which that irritates them or stresses them out, you need to find that and bring that down. And make sure the TV and phones are not a diversion while eating. Okay, because that's again a tendency of not eating right. Noises, depending upon the family, or the TV noises, the environmental noises, so it has to be like calm down, so that with that calmness, they are able to eat their food and they're able to choose their food and not like being choosy. Okay, then your junk picky eaters won't touch certain food, again due to their senses. And if you change a food in, if they are in a routine, because autistic child always has favorite foods and they're very like choosy with foods. They do not like want to try for new foods because it will intimidate them. So that we need to understand. And sometimes they're even color oriented. So few of the children are like, if they like red, be it they will choose red in everything. So it can be from their clothes to crayons to paints to the food also. So they will want everything in the same color. So these are few problems where nutrition is lacking in a autistic child. So now I would be just giving you in the next slide, you will be understanding how do we improvise. So just giving you some kind of hints. So this is not the only changes that you need to do. So for food smells, if the child is getting irritated with the smell, or suddenly you see that your child starts being cranky suddenly in front of the food that you've made, it can be due to a smell. So make sure that you use a fan so that somewhere the smell of the food is diverted. Slightly avoid on garlic on onions, and cover serving plates so that when they're eating, the smell of the food is not hindering their eating patterns. And maybe you can even add some essential aroma candles, or maybe these aroma sticks, so that again it's diverting them and calming them while eating also, and it's not irritating them and stopping their food patterns in between. Okay, and definitely chamomile and lavender are like one of the very good scents that can be used to reduce on anxiety concerns as well. And definitely try serving like cold or warm meals rather than hot, because hot meals tends to like give out a lot of smell. So that is again one thing. Secondly, how do we introduce new food? So you must be worried being mothers, or maybe when you are talking to parents who are having children who are autistic, you have to tell them to introduce new food slowly. As I told you, they have a routine. They do not like a sudden change. So start any new nutrients or any new nutritional food that you want to add as small as a grain of a rice. Okay. Then when they see it, first few days they will see it, they'll look it, they will touch it, they'll do all that. Then slightly increase it to a pea size. Maybe that time also they will not eat. But when you're slowly introducing these new foods, telling okay with the other foods that they're eating, then slightly when they're trying to, maybe they will taste it and they will like not like it. But slowly from increasing to pea size, go to half a teaspoon. Then they will start opting for it. Then maybe you can slightly add it to 1 teaspoon, and then increase the quantity accordingly. Okay, do not do or do not introduce your new food at once. They will definitely not opt for it, and they will start ignoring on the normal food that they used to eat also. Okay, so taking you to the next slide. Okay, so how do we accept new foods? How can you add in new foods? Is definitely fortifying the normal foods that they eat. Okay, so here I've given an option of pancakes. So that can be in, for us, it can be roti. You can add it in the normal foods. So whatever you are adding, just add that extra ingredient. So in a pancake, we definitely add an egg. So over here, I'll say add an extra egg to increase the protein. Okay, with that, make the food into much more make them look good, make it into very good fun shapes. Okay, you can tell them that this is a fish and this is a dog, those kind of, you do get these cuttings, right? So you can cut it into fun shapes and then add some different new colors, because even an autistic child is very much prone to colors. So when you like teach them and then play a game with it, as you can see in the next slide, I've like made the tic-tac-toe. So try have making some games out of your food and then making them eat, right? With that, new presentation. So rather than opting only for one set of presentation, try opting for new presentation. And if you want to introduce new food, try giving with their favorite foods also. So that also will help them to at least try or look at the new food that you've introduced, right? Next slide. Okay, so if you see in this, I have put that yogurt, they have put it in the first plate, yogurt is more, and then you have the other foods. But if your child does not like yogurt, so how do we improvise it so that he's not getting anxiety, or maybe he's not getting upset? Is just give him a spoon of it. As I've been telling from the 3 slides, just introduce with a spoon so that and if they are eaters, like see, imagine you're giving a plate of all of this, like in a layer, and they're not eating it, then why not divide it and give? So then you will be understanding what is the main aspect, or which is the main food they are not liking. So then accordingly, you can change the sauce, or maybe you can change the different kind of ingredients for them as much as possible. Okay. With this, I would be telling you mainly about in the next slide. I would be telling you about the nutrients. That is okay. Again, this is another slide which shows from fries to carrots how to change it, because potato fries is again high on calories. So from this, make it into sweet potatoes. Then you can chop the carrots the same way and introduce it into cubes and then to steamed carrots. It's the same thing. From junk, how you can make it to strawberries or a fruit. or you can do it to yogurt. Okay. Yeah. Going to the next slide. What are the nutrients needed? Okay, so over here it's like too bright, but let me just tell you. Um, we need omega 3. Okay, omega 3 plays a very important role for the nutrients. Okay, because you might see an autistic child sometimes is hyperactive. Okay, and due to the sensory overload also, they get a lot of upset and they become very anxiety issues come. So this, what happens is, this increases the enzymatic defect in the brain, which is reducing on their essential fatty acids naturally because of the stress that's happening due to the factors around them. Okay, so omega 3 plays a very important role to calm them with their anxiety levels and activate on their defective enzymes due to the stress, which will improve on their behaviors, their mood, the speech, focus, and definitely the sleep. So that's how omega 3 fatty acids play a very important role for the nutrients of an autistic child. Next is your calcium and magnesium. So if you see, most of the research is done, they've seen that due to the nutritional imbalance that they were having, the autistic child, due to so many factors that we've already discussed about, uh, they tend to have a deficiency of calcium. And they've seen that autistic children have thinner bones, okay, due to the lack of calcium, and few children are even into this gluten free and casein free diet also, right? So due to that, these people are deficit of calcium or magnesium. But calcium plays a very important role to support the bone growth, the teeth formation, and magnesium being a cofactor for the neurotransmitter. It actually improvises on the social reactions and emotions. It improves the nervous health and definitely the brain functioning. So that's what your magnesium and your calcium together helps you with the improvement on an autistic child. Then comes your iron. So iron is an important mineral because if you see in the hemoglobin which is found in our RBCs, a part of the hemoglobin, which is your heme, is made of iron. Now that is responsible to transport oxygen to your overall tissues and to remove carbon dioxide from your body. Okay, so that is why iron is needed for the synthesis of neurotransmitters, for the improvisation of your oxygen levels, and it's somewhere taking it in the right quantity with the right kind of changes that we're going to do, it's going to improve on the behavioral and the cognitive development of the child. Okay, then is your vitamins. So I have like combined your vitamin A, B, and D together. So again, all of this is going to help you with the sensory perceptions. um, and vitamin A especially fixes on proteins which is lacking on the child. So it helps to fixes the proteins if they're lacking, or if any kind of rupture is happening, protein is on the lesser side and the repair is not happening. The vitamin A will help like a repairing of the protein in the autistic child. Okay, vitamin D is again very much important because it helps with the absorption of calcium, and the right amount of vitamin D in a child has sometimes reversed the symptoms of autistic behaviors. So that is why vitamin D is also important. And vitamin B, again, as I told you in the previous, many of the autistic children are having problems with their stomach related concerns. And vitamin B helps with the detoxification, it helps with the gut health improvement, because that is where the nutrients are absorbed to the maximum. So once your intestines are cleansed, again, the child will feel hungry. The hepatite is going higher. They are able to eat the food when they're hungry. Okay. And vitamin D equally helps with any kind of neurological improvement as well. The last one, which is your zinc. So now zinc will again help you to improve the immunity and to eliminate toxins also from the body. Okay, so these are the main nutrients which can give you that extra support to your child's food. Okay, so now taking you forward, I would be able to understand, make you all understand why supplements are required. Okay, so firstly, as I told you, many are fussy eaters and they are eating only certain foods. And for a variety of reasons, they are definitely nutrition deficit. For that, supplements are a boost or a support for them so that they are getting the required amount of nutrition that they are lacking from. Okay. So if you see over here, Firstly, it reduces on the symptoms. So the main thing that we need to be taking care for an autistic child is their behavioral actions or the symptoms, which is again making them to go on the higher side of the behavioral or the communication or the social skills. So somewhere the right nutrients and the support of supplements that they're not getting from food, due to food definitely right now is not having the right amount of nutrients, firstly because it's adulterated. The quality itself is poor right now that we get. So in that, even in that condition, they are like choosing or like they're not opting for variety. They're like very picky eaters. So due to that, this supplement will give an extra support, an extra boost to reduce on the symptoms of autism. Secondly, it will bridge the nutritional gap. So as I told you, whatever nutrients is needed for the body, it will help like a very good support, and to support on growth, development, and learning. So automatically, with the symptoms being reduced and the therapy is taken, in the right way, with the family helping them and supporting, and we all helping them and supporting with any kind of environmental concerns, um, it will help them to develop and learn a lot in behavioral changes as well. With this, in addition to this, it improves their language, it improves their social skills, like symptoms like reduced repetitive behaviors, it improves attention, and definitely better sleep and less irritability as well. So all of this are the main reasons why the supplements can be a great support for an autistic child. Now, taking you forward, what are the supplements that can help the autistic child is, again depending upon because if you talk, like imagine being an ABO or maybe being a customer, if you're going to talk to a person who you've met having an autistic child, you have to first observe the child, you have to like ask them what kind of foods they eat, and depending you can suggest them the supplements where whichever source is lacking on them. Okay, so over here, firstly, we have kids chewables, Nutrilite kids chewables, Nutrilite DHA yummies with omega-3. Then we have Nutrilite kids calcium, magnesium, and cocoa. And then we have kids chewable iron. So in the next slide, I'll be talking more about it. So firstly, coming to your kids chewables. So this is a multivitamin for them, okay, because again, it will support on them with a different set of vitamins and minerals. And it has almost 21 vitamins and minerals, where 13 are vitamins and 8 are minerals, which will support on their complete health perspective. And it comes from fruit concentrates, which provides phytonutrients. So it will improve on their antioxidant levels. So any kind of illness or bacteria the body's factors are exposed to, at least they have the fighting capacity. Because if you see, due to the less nutrition in them, their immunity is also very low. So they tend to, prone to get illness fast. They tend to get infection fast. So that is where, when you're improving on the antioxidant level, at least the fighting capacity of this is taken care of. Okay, and over here it comes with a very nice natural orange, vanilla, and licorice flavor. So this is the flavor that is used, and it is chewable. Okay, next is your DHA yummies, which is your omega-3 fatty acids, which is again having your DHA and EPA, which helps you with the brain development and function, helps with vision related concerns, and it helps to improve the child's behavioral changes. The symptoms is taken care on, because if you see, brain is made of fat, and if you're giving good fats for it, the absorption of these fat will help with a better development and better kind of neurological concerns, that's going to support on the symptoms that they're facing. Okay, and definitely it calms the child when they're having this, when things are upsetting them, or which is stressing them out. This DHA yummies, because of the presence of these DHA and EPA, it actually helps them to calm them, which is again a very good support from the supplement side. Okay. With this, one extra benefit is that DHA yummies is added with even vitamin D. Now, vitamin D, as I already spoken, very good for absorption of calcium, helps with the development of bones and normal functioning of human system, and definitely it helps with reversing the behaviors as well. So researchers have shown that the right amount of vitamin D can reverse even the behavioral changes in autistic child. Now again, this is a flavor which is a tangy orange lemony flavor. Okay. Thirdly, which is your calcium, kids chewable calcium and magnesium. It's coming with a cocoa flavor. And as discussed, calcium helps with the bone maintenance of bone and teeth, and magnesium for the normal functioning of child's nervous and muscular system. Okay. And then is your chewable iron. So I've just picked up the first two is definitely a must for a child, for any autistic child that you come across that you want to give in, because that is a very good combination. The third and the fourth one, as I told you, depending upon what the child needs, we do have a different set of nutrients for vitamin C as well. Okay, and we do have even for fruits and vegetables. So depending upon what your child is not opting for or not having the right amount of nutrients, with kids chewable and DHA yummies, you can shuffle with the other supplement which is required to support on the nutritional concerns. Okay, so here is your kids chewable iron, which is again, as I told you, which is very much important for the oxygen transportation. And the iron used in our kids chewable is ferrous fumarate, which is readily absorbed by the body, and it's coming in a flavor which is your raspberry cherry flavor. Okay, so as I told, with the right therapies, with the right changes, the support of these supplements will definitely improvise on reducing on the symptoms of the child, and overall support of the growth and development of the child as well. Okay, so now I just wanted to tell you from the diet point of view, that I have told you, okay, how do we introduce nutrition and how do we improvise? But just a small thing that try adding, if they are not able to get introduced to new foods also, try fortifying their normal food with maybe nuts and seeds. Maybe you can powder them and add it in their normal routine. So we do have pumpkin seeds, you have sunflower, you can, powder oats, you can even add some your cashew, your dry grapes, a little bit of jaggery. So make it all into a powder and mix it and fortify it in their normal foods, because all of this is again going to support on their nervous system. So nuts and seeds like your almonds, your pistachios, your walnuts. So if they're not able to eat it directly, so whatever you think is nutritious but they're not opting for it, try just adding on, fortifying it to your normal foods. Okay. So next over here, I would be just talking to you about telling how can we support. Okay, like as a normal person, how can we support an autistic child, or if you come across any person who's autistic, what can we do? Okay, so basically we need to observe firstly. Okay, so we need to be very patient. Okay, the very important thing is patient. Being patient helps the child also to understand clearly. Secondly is your environmental issues like your noise, your sounds, your light, all of it, because as I told you, too much of sensory overload can upset them a lot. So as much as possible, reduce on the environmental issues when you come across that you have met an autistic person by observing their symptoms. And try using simple words. Do not offer very long sentences, or just use very simple words and they're still not able to understand simple words. Then visual communication is necessary. Okay, so you can like show a picture of it and then tell them, ask them some simple questions. Then don't say no. So this is again for the parents or for anybody that you need to talk to or educate any other person. Never directly say no to the child. Direct them to do it politely, and once they have finished that whatever they've finished, whatever you ask them to do, then reward them or maybe clap hands for them, like make them happy that they have done it. It can be a simple like maybe sweeping the house, maybe like it can be like keeping the table correctly. Okay, so just mess it up and they will do it. After that, you just need to reward them. So make sure that they are special. They feel happy for what they have you've been asked them to do. So that will again help them to listen to whatever, and they will actually do it if you are directing them to do it next time. Okay. So with this, I just want to give you a small testimonial from my side with a personal experience. Okay. So before we touch into the facts, as I told you before that I've spoken to a lot of autistic children's parents, and definitely I have to say, I do have an autistic younger brother, and I'm telling you that it is really a different aspect if he was not there in a house. Okay, he's like completely changed the view of ours. The world that we see right now is completely different. And with personal experience, with the therapies, I'm telling you, the supplements have supported him a lot. Okay, because the food that he used to eat was very choosy, his sleep pattern was very bad, and his anxiety levels were used to, go up so high that he used to, be very cranky all the time. He used to like hit himself on the wall. So it was that kind of a symptom that he had. Okay, it was almost like level 3 symptom. And let me tell you that we've been using it now. He is almost 7 years old. We found it out when he was 3 years. Okay, so now his behavior has changed a lot. Like he has the eye contact. He communicates with new people, even though it's for him like a little. He's firstly he doesn't, but yes, he repeats his words when we ask him his name. He tells his name. So all this I can surely tell, it's definitely with the changes that we've done. Okay, and how we've supported him with the therapies, and supplements have supported him a lot, which have actually helped him, especially the DHA as well as the chewables. Kids chewables have actually helped him a lot. And he's been taking care, and now he's been like actually he loves, right now his favorite food is chicken biryani, so he keeps asking for that. But otherwise, any new food that is introduced to him, he's happy to eat it. Okay, so that's the personal experience that I have to tell, having an autistic brother. So next, going to the facts. Okay, so if you see, almost 70% is getting increased every year for the autistic child, and normal diagnosis is about 3 years. Okay, that's when they tend to do their behavioral changes can be seen. And if you see, autism is found less in children who have been, if the mothers have been taking vitamins, and their minerals are on the good side and maintained well, then the autistic child, I mean, autism is on the lesser side. And third is, make sure that you observe and see what your autistic child is interested in. Okay, so do not force them to do only academics. Sometimes they might be good in art, sometimes they might be good in music. They have, as I told you, what is difficult for us, it's very easy for them. So whichever you need to, being parents or being like educational teachers, you need to be telling them that let them go with their interest and they will excel in that. Okay, and if you see, 1 in 59 children are diagnosed with autism nowadays, and 1 in 68 or 1 in 15. With that, let me tell you, all autism means they're always unique, totally intelligent, and sometimes only mysterious. Okay, so children with autism, they need friends. It's not like they do not need friends. They need friends, but we need to give them trust and understand them. With good communication and patience, it's very, very easy to be friends with them, and they will also trust us. And let me tell you, children with autism are not ill. Okay, they just have a unique way of viewing the world. And if we are understanding them and patiently listening to them, we are also able to be a part of their world. So taking to the next slide, I just want to end it by telling we need to accept, understand, and love autism. Okay, so now over to Jasleen for any queries further.
Thank you, Susan, sir, for such a heartwarming presentation. Before we move on to the questions, there is a quick poll question that is coming for everybody. I would request all of you to please answer that and let us know whether this session was helpful for you or not. Thank you so much for your comments. The poll is still on. I'm requesting you all to please also poll and tell me whether this session was helpful or not. So, Susan, you can scan. There are some
Hi.
questions that we have. Yeah.
Okay.
So,
So,
yeah, Susan, one question that I saw was this omega, the DHA yummies that we have. So, if somebody is a vegetarian, what can we give them? Like, what can we do if that person is vegetarian?
firstly, I would suggest maybe you can just give that, but otherwise, DHA is there's no like alternative for the DHA that we have because it's a very good source of omega if it is in the children's range. Because omega-3 fatty acids is the best that we have. So please do not see whether you're like veg or non-veg. It's a very good support for the neurological function. Otherwise, we do not have directly anything else which is a veg source with the DHA yummies that we have.
Okay, okay. Also, we have suggested now for kids. So, what if we figure this autism, quite later in the stage, and if somebody is at 16 years or 15 years,
Hmm.
then what do we suggest them?
So then you can go to the adult range of supplements, which is your salmon omega-3, your multivitamin. Again, depending upon the choosing of the foods, you can add in calcium or cherry iron that way. But definitely, multivitamin, which is your Neutralite Daily, and salmon omega 3 will do good for 12 years plus.
Okay, so yeah, here somebody asked that why haven't we talked about the protein drink, the drink and CFV?
Okay, so that's as I told you, CFE is for few children. You can shuffle it. So as I told in the while talking about the supplements, few children are like very choosy to eat fruits and vegetables, and few are not. So for the children who are not opting for much of the fruits and vegetables, you can have an addition of the chewable concentrated fruits and vegetables. And coming with the protein, why I have not touched on that is because many of the autistic children have been advised to take gluten free and casein free food diet. But if they are not on such kind of a diet, definitely a protein can help 5 years above. But if they are already on that kind of a gluten free diet and our protein is having wheat in it, so that's the reason I didn't like specifically talk on protein itself.
Okay, yes. And yes, there was one person with the concern that their autistic child is not having milk or curd.
Yeah.
So that maybe is that because of the smell of the smell?
It can be the texture. It can be the texture which is actually not wanting the child to have. So as I told, slowly introduce the child with just with with the size of a rice and then slightly increase the dosage of it. But if you really want again a perfect consultation, definitely I would help you with a consultation, ma'am, because that's again a personalized one.
Okay. Yes, there are a few people who are asking for what products to suggest. So we have
Yeah.
given a very general view of
Hmm.
the products and mentioned what are the top priority products. But yes, if you are dealing with a autistic child or a person, you can get in touch with our consultants. They will guide you better with how many tablets to take, when to take. So they will give you a very personalized consultation, which I recommend. This is not the platform where we will tell you the right recommendation. Here we have only talked about the supplements which will be helpful in general, right?
Yeah. And I wanted to
Also,
tell you, like I got this for my own brother. He didn't. He couldn't have the supplements. He didn't wanted to chew it because that's also new, right? So what we can do is sometimes you can crush it and give it also. So no problem, and add it in their foods.
okay, yeah. So as Susan is suggesting, you can crush the supplements and add them to take these. So that's what even Suvarna is asking. Generally, these kids don't take tablets like
Yeah.
Omega. So any trick suggestions? She's asking the same. Yeah. Also, this thing, Susan, I'm not sure if you'll know this, but is it possible that from childhood a child is going to be autistic, or can they develop this to a little later in their years also?
No, actually, they can develop this from a very young age, from from like 6 months old itself, they might have it. But because of the behavioral changes can be seen when the child grows. Because when the child is like walking and all of it now, you it is actually on from the young age itself. It's not like when they grow itself they get autism.
Yeah,
It's
so
not
that's not possible that they have later become like somebody who is fine up to 12 years, suddenly they cannot become autistic, right?
No, no, that cannot happen. It can be a different other environmental stresses that is making them, not communicating with the society. But autism suddenly cannot, attack a child just like that. No.
Okay, okay.
Somebody I
I'm
can see something
reading.
like,
Yeah, yeah. If you see some questions,
yeah,
please them.
so I can see,
Please, I'm reading one more. There are another. One second, Susan. There are another 200 people. I'm waiting for your response. Please use the poll to let me know whether this session was helpful or not. Thank you. That we have already got response from 600 people. I'm just waiting for another few more people to respond. Thank you.
so yeah, I can see somebody telling arrange the supplements in priority. As I said, chewables is one, ma'am. Utilize chewables, and then is your DHA yummies is definitely a must. With that, depending upon what is lacking on your on your child's food plate, depending you can offer calcium or iron or vitamin C or concentrated fruits and vegetables. But yes, chewables and DHA yummies is definitely a first priority. With that, you can definitely add calcium also being the third.
Uh, so there's a question on how about children with Down syndrome? So how is Down syndrome different from autism?
That's again a different topic.
Okay, so that is not related to this, right?
Yes. Yeah, some symptoms are related like that because, as I told, it's a spectrum. Autism is like a spectrum, right? So the symptoms can be similar, but again, it's again a different topic that we can like talk about maybe in some time. I
Okay,
can
so there's
talk
a
more about
question
it.
here again. I think you can help us. So, is it necessary for these students to go to a special school or even normal school is okay? Like,
So there are two different kind of schools. If a person is okay with a normal school, still they need that extra help from a therapist, or you have to put them into a different therapy so that the normal school at least they are able to social interact. But firstly, you need to, as I told, you need to understand what are the characteristics of the child. If the social interaction is well and good with him, then you can opt for a normal school. But if you feel the characteristic that as I showed you in one of the slide, right? So depending upon the characteristic of the symptoms of the or the behavior, you can offer a special or a normal school.
okay,
But definitely, if in normal school, additional therapy is required. Only a normal school won't be sufficient.
okay. So, I'm sorry if I've missed any question because there are so many messages. If it is something generic, please put your question again so that I can see them now. Yeah, any exercises, Susan, do you suggest any exercises?
Okay, so if you see, if you do some like if in therapies and all, they add in some music, but the most accepted exercises for autism child is definitely they put them into yoga. Okay, so because that will calm them. So do some simple flexibility or just put on some their favorite rhymes. Tell them to jump. Tell them because you cannot put them into a pattern of exercise. They won't be able to do it because their focusing skills are very less. So let them like slightly jump. Maybe you can tell them to hop, okay, and touch their feet, touch their head, go up. These kind of simple exercises is more than enough. But again, make it into a routine slowly. So first time keep it for 5 minutes, then slightly increase it morning 5 minutes and evening 5 minutes. So that way you need to increase the timings and put them into a routine where they have a exercise time as well, but not like specifically any form of exercise. It's just to reduce their anxiety and stress. You can give them an exercise routine. But we are into yoga, so we do that.
Even omega 3 can be crushed and given.
Yeah, no problem.
Okay, so yeah, Purnima, so here is your answer. Even omega 3 you can crush and give it to the person.
Or if it's in the adult range, you can like slightly slit it, and the oil can be mixed in the normal foods and given. Nothing to worry if they're not able to, take it for the adult range of
Okay,
milk.
okay. I think they were asking for the adult range only, maybe. So what about
Okay, yeah, yeah, because that's a soft
yeah?
shell.
What about Brahmi? So if a child is 13-year-old autistic child, can we add Brahmi to their
No problem.
no
Yes,
problem,
no
right?
problem. That
Brahmi
can be
will be
given.
helpful. Is Brahmi going
It
to be
will
helpful?
be. It will help. It will help in the adult range. Definitely. So let me just give one hint for the adult range because I didn't speak about that. So adult range, you can give a daily salmon omega 3. You can give a Brahmi, and if they are like 20 plus or anything, also slightly you can even add in an ashwagandha, no harm, because that will again calm them. Okay. And sometimes I just wanted to add this also for few people, as I told, they have a lot of stomach related issues. Once in a while, if it's the adult range, you can use the Nutrilite fiber. Okay. But if it's a younger range and you still need to add some kind of supplement which will help them with their stomach related, you can use our Nutrilite fiber as well with a lower dosage. So I won't be giving an adult dosage. This is only from my side that I'm giving. Maybe just a half a teaspoon you can have like once in a week or something, so that constipation related issues or cleansing of the intestines is seen. Okay, but not the right dosage as for the adult range. It's just my personal suggestion.
Okay. This autism is not hereditary, right? And how does it happen? Why does it happen?
It sometimes can be hereditary because we do not know the exact cause of autism. Okay, so
Okay.
even though researchers have seen, they've still not found the perfect cause of autism. So it's like still a
Okay.
question mark.
Okay, so this one last question here for Susan. After this, again, I request everybody, you can share your feedback or your any recommendations to me on my WhatsApp. You can get in touch with Sapna and Susan, any of them, for even supplementation, what has to be suggested. So this question here, yeah. So if an autistic child shows interest in vigorous physical activities like dance, can we let them go for it?
Please, no problem, go for it.
Okay, okay. So, okay, I think this one question you can answer because you've mentioned the fiber. So, when can we start giving fiber? Lowest age where fiber can be given to child?
If your child is okay by like maybe like better 4 years or 5 years plus, best is
4 years
that
or
time.
5 years plus. Okay, done, done.
But with a
So
very
that's
low
it.
dosage, because it is a adult range, just with a low dosage, because we do not have anything direct for as a free. So that's the reason I've given an adult range with a lower dosage.
Done, done. Thank you so much, Susan, for patiently answering all the questions. And again, I would really like to thank Susan for coming forward and taking this very emotional topic, which is also very close to her heart, and sharing all the information and knowledge with everybody, with so many participants of us. So I'm very thankful to Susan. I'm thanking all the participants who have around 98% voting on the feedback, and 99% have said yes. So thank you so much, people who felt this was not up to the mark for you. Please let us know your feedback and comments. We are more than happy to um, improve ourselves. So anything that you would like to share, Susan? Yeah.
Yeah, so as if you have already done the closure. Thank you so much. And yes, as told, if any changes we need to do or any suggestions, please let us know. And I've anyhow put up my number. So for personalized consultation, you can definitely ask me or Sapna to help you with the same.
Yeah.
Thank you.
Thank you. Thank you so much, everybody. Thank you for joining us on a Sunday and looking at the number. I think we will at least try to keep one session every Sunday because I think this is a good time for all of you to join us. So stay safe, stay healthy, take care, and we will see you all very, very soon. Thank you. Okay, I'm putting up my number here for people to connect with me. If you're not getting these meeting links from me directly, you can WhatsApp me with your name and your location so that I can save your number and I can add you to my broadcast list. Okay.